So good evening, everyone. Welcome to our Town Hall segment for Black Maternal Health Week regarding chronic conditions and pregnancy. I would like to introduce two of our panelists. We have Dr. Raquel and Tiana Woolford. Dr. Raquel serves as the CEO of the Fertility Advantage, and she is the Director of Integrative and Preventive Medicine at Care Fertility. Care Fertility is one of the leading global fertility benefits provider for multinational employers. We also have Tiana Woolford, who is a co-founder and CEO of Sickle Cell Reproductive Education Directive. It was conceptualized in 2020 and established as a nonprofit in 2021. So welcome you guys to our town hall, and we appreciate you being here to discuss sickle cell, chronic conditions, pregnancy, and fertility.
Thank you for having us. I'm excited to be here, and I have two panelists with me from the sickle cell community, Brandy and Ashley. So before we get into the discussion, I'll just have them briefly introduce themselves. Brandy, you can go first.
Okay. Hi, my name is Brandy Martin. I am 31 years old, and I have SS sickle cell disease. And I have one daughter who's 12. I'm excited to talk today about, fertility and having sickle cell and pregnancy, because I've always known that I wanted to be a mother. And even though I have one daughter, I definitely have struggled with fertility. So something near and dear to my heart.
Thank you. Ashley.
Hi, I'm Ashley Lindsay. I have sickle cell SS. I'm 31. I live in Maryland, and I have a 10-year-old daughter, and I'm also pregnant with my second. I'm 9 months today, so I'm excited to speak about this today because I think when I was looking for this type of education and awareness, I think I didn't find it. So I think this will be nice to, have other people aware.
I totally agree with you, Ashley and Brandy, what you were saying. Like, there's really not a lot out there related to women with sickle cell, men with sickle cell, and reproductive health. Well, not until now. So basically, just a little bit of background. I co-founded this organization with two hematologists who have been really big in women's health. And it really was inspired by my own struggle with infertility. I had a bone marrow transplant and was exposed to high dose chemo and radiation. And when I expressed, basically at the time that I had my bone marrow transplant, I was really depressed and defeated because I was in and out of the hospital so much. And I had so many complications related to sickle cell. So I expressed basically willing to risk anything if I could cure my sickle cell, except my fertility, because like the two of you have always wanted a lot of children. And when I said that, it was this young white doctor, he looked at me and he was like, I don't know why you'd even be worried about this process making you infertile, because with the complications you've already had from sickle cell, I'm pretty sure you're already infertile anyway. And hearing that at 19, it was like devastating. And I remember going home, doing a Google search, and I didn't see anything related to fertility and sickle cell. I just saw education for women with cancer. And when I saw that egg freezing could be more than $10,000, I started looking at grants, but they were all for women with cancer. So then, like Ashley was saying, I kind of realized that it was more than just fertility. It was everything from puberty, pregnancy, hormones, priapism, which is what the men go through. There was really nothing. So that's how we expanded and became the first and only organization to prioritize reproductive health. So that's enough about the organization. And now I'll get into the panel discussion. So Brandy, you mentioned having issues with fertility. And I know this is like a really personal topic, but I'm curious for you to walk us through what that journey has been like.
Okay, so originally, even just as a teenager, I'm not even sure why the discussion was even being had, but I was told I wouldn't be able to have kids. And I hadn't even made it to that part of my life yet. And so later on, even when I got pregnant with my daughter, I didn't think that I could because they told me that I couldn't. And once I was pregnant with her, I was encouraged literally until I was like 6, until almost my entire pregnancy, to abort her because it just was not healthy for me to carry her, that I was going to harm myself and her, if not both. So that was the beginning of that journey. And as I mentioned earlier, now I am going through the process again of wanting to have another child. And at the hospital that I'm seeing at, we only have one sickle cell clinic here.
Mhm.
And they have told me that they basically would not help me to have any more kids. I've taken many tests that say that my body is capable of carrying children, but they're like, no. And so they would not help me at all. I have a primary somewhere else, and he ended up referring me to someone that is helping me now with looking into things, but they wouldn't, help at all. They just told me, no, you can't have kids, with no reason behind it. It's just no.
That's crazy. I'm gonna come back and unpack that a little bit more. But Ashley, I'm curious to know because, like Brandy was saying, I have heard that it's not healthy for me to be pregnant. I know friends who have told to never be pregnant. I know people who, when they became sexually active, their doctors encouraged them to get their tubes tied. So, have you or any of your friends ever been told that they could not have children or should not have children?
Yes. Um, at first it was different in the very beginning with my first primary care doctor. He said that he was the first one to bring the conversation up. He said that if I ever wanted to have children, do it as soon as possible, do it while I was young.
Hmm.
Um, when I switched doctors, because that was my first pediatrician, when I switched doctors, that's when I was advised against it, not to have children, like at all. They was just like, no, don't think about it. That was even before I even brought it up. Like I didn't even bring it up at that moment. It was just always something that was told to me, like, no, it's not an option. Don't think about it. Don't ask me. It was basically one of those things.
That's
So I
crazy.
only had one person that, told me, if I wanted to do it, it was possible. But everyone else, and even when I went to adults, when I transferred to my adult doctor, they was highly against it. The same thing with Brandy, told me to get an abortion, all of that.
Wow. Were they just concerned that it would be harmful to you to carry a baby? Was that why they were telling you that?
They just didn't feel like, they just said with the science with sickle cell, they just didn't feel like it was possible. They didn't feel like it would be a good idea. And even though I told them before I had got pregnant, I told them I had got my partner tested and to make sure that they didn't have the trait. So I did my research before I got pregnant, with everything. So it wasn't just it happened. It was a plan. It was a plan, and I made sure that I did all my research prior. So even with that, it's just they still were like, we don't think it's a good idea. The baby isn't going to live. But at that point, I wasn't even having complications yet. So
Wow. That's interesting because that's been one of the most disturbing realities since founding this organization, like trying to make fertility preservation more accessible to us. I have run into people, healthcare providers, policymakers, who really believe that we're too sick or too poor to even have these conversations. And I just think that for so long, the focus has been on survival and not quality of life. And it's this whole thing of like, you should just be grateful to be alive. And it's like, no, we want the same things as everyone else. We want options, and it's not enough. Like, we don't want to just live with this disease. We want to thrive with it. So that's crazy that both of you were told that as well. Um, so Ashley, you mentioned it a little bit already. You said that you did get your partner tested? Because I want to get into like the decision-making process a little bit. So Brandy, did you also get your partner tested before you conceived, or was that something that came up after the fact?
So the first time, like I said, I didn't think that I could have kids because that's what I had
Right.
been told. But this time around, he has been tested and things like that in the decision making now. But you know, because I was told that I couldn't, it kind of made me ill prepared. Like I didn't think into those things and you know what I should do so that I could be more responsible. So we were tested while I was pregnant.
Okay. And that's no
then,
fault of your own. That was a lack of, that was ignorance on the provider's part to make you think that it wasn't even a possibility. So that's one of the things that we advocate for with the organization is like this thing of informed decision making. And you were kind of robbed of that your first time around because you were told you couldn't even have children. So that's interesting. So for both of you, Ashley, did you have to stop your are you on hydroxyurea?
No, I've never been on it.
Okay, because that's like the longest, most researched drug. We've had it for over 30 years. But one of the issues is that when you're trying to conceive, you have to come off of that. So Brandy, having to come off of your hydroxyurea, trying to conceive your second child, has that caused you more complications with your sickle cell?
Honestly, I don't believe so. I don't think so. But it's hard to say because honestly, before I actually made this decision, I had gotten sick and they took me off of it because they didn't know whether it was that or the Adacvio that was making me sick. And so they took me off of it then. And so I just decided to stay off of it, you know, as I decided to look into trying to have another child.
So you're off of your Adacvio now too?
Yes.
Okay, because that's another disparity is that we don't have any disease modifying therapies that women with sickle cell can stay on when conceiving or during pregnancy, which can cause this vicious cycle when you have to get off of your disease modifying treatments, and then you can have more complications from sickle cell. So that's something that when these researchers are doing, they should be testing the safety of these drugs for pregnant women. And so that's just yet another burden that we have to go through. But since both of you have already gone through one pregnancy, can you talk to us about the process? Did you have any complications before or after?
So with my daughter, I did. I ended up having her at 7 months because they had to stop me going into labor twice. And and so the entire pregnancy, I was on the most medicine that I've ever been on in my entire life, even now, like, and she's 12 years old. I was on the most because I was really sick. But it's things that I've learned about myself to help me to be able to control my sickle cell. And I don't think that I needed all of the medicine, but to answer your question, yes, I was, the way I found out that I was pregnant with her was because I went into a bad crisis at 5 weeks. And from there all the way up until I had her, where I had an emergency C-section because my body was literally trying to make me have her because it felt like she was what was making me sick. Yeah. And so I did have a really hard pregnancy.
Ashley, what about you? How was your first pregnancy?
Mine was the same. It was hard. They put me on a lot of medication, which I wasn't on a lot of medication either. I was on the smallest dose. Before then, I never really took medication, never at all. When I got pregnant, I experienced so much pain. So in return, they put me on so much medication. Yeah. They also started me on blood transfusions once a month. So that's when that started as well. So I end up having her. I end up like Brandy said as well, like I kept trying to go into labor early. So I ended up staying, I ended up living at the hospital for the last 4.5 months because I was just in so much pain. I was constantly trying to go into labor and it was just like they couldn't control it. So I had to stay there for the last 4.5 months of my pregnancy until I gave birth. They actually ended up putting me on an epidural before I even gave birth, way before I even gave birth, because I couldn't walk. I couldn't do anything. My body was just in so much pain and so much stress. So they tried to do an epidural beforehand to try to ease the pain.
Wow.
Yeah, so it was a lot.
That sounds unbearable. So we talked a lot about like the physical implications, but having those complications, I'm curious to know, what does that do to your mental state, having to be in the hospital for 4 months? I mean, Brandy, you kept trying to go into labor. Like, what did that do to you mentally?
Um, her middle name is Faith because my mom was like, no matter what happened, no matter what they told you, she was like, you was like, no, I'm gonna have my baby. She's gonna be fine. She's gonna be healthy. We both gonna be okay. And I just was not trying to hear it. Like I knew I wanted to be a mother. And even though I was going through everything that I was just determined to see it out. And I just knew that we were both gonna be okay. So that was just my mindset and I stayed with it.
That's great. Ashley, what about you? What kind of headspace were you in?
It was a lot. Honestly, I was depressed because, everyone has a life. So everyone can't be at the hospital with you 24/7.
Yeah.
My family was supportive. Like they were very, very supportive. They were there every day that they could be, but it just was a lot, like being away from home, being away from your partner. And also my partner was in the military, so he was already away. So it was just already a lot as is. And
Yeah.
then being there on top of it just was more. And so I was extremely depressed during my pregnancy.
Wow. Well, as you both know, there is a lot of fear and anxiety in the sickle cell community about conceiving and carrying a healthy pregnancy. So I want to hear from you as two who have done this successfully and have these beautiful children now. What advice would you give to other women in the community who are nervous about getting pregnant?
Um, I would say do your research. I would say do your research. So reach out to other sickle cell moms. If the research, if the information isn't out there for you to type in and look up on Google,
Mhm.
look for sickle cell groups, look for sickle cell moms. That's what got me through it. I actually reached out to other mothers with sickle cell because there wasn't nothing out there for me to, read or anything. So me making those connections with people helped a lot. Um, if you're trying to start, I would get your partner tested if possible. What else would I say? Make sure it's you're in the best health as what you can be,
Mhm.
and just pray and don't listen, to everyone. The doctors are going to tell you no regardless. Most of them are going to tell you no. I would I would just pray and just go with God.
Hmm. And that's powerful what you said too. My chief medical officer, Dr. Kim Smith Whitley, she really stresses that too, is like being in optimal health, doing everything you can, taking your medications, keeping your appointments, self-care. So I think that's really important. Brandy, what about you? What advice do you have for other women?
I agree with her, and it's sad that we can't turn to our doctors about this and talk to them about it. But I would encourage them to reach out to other women that has been through it. And even with the doctors, like I said, I'm seen at a specific hospital here where all my carriers and they were all on one accord that they would not help me. But seeing who else you can see, like what they say, get a second opinion, because now the person that I'm seeing now, he's like, there's no reason why you can't have children. We've run every test and there's nothing saying your body can't handle it. And he was like, at the end of the day, you're a human being and you deserve the same rights that everybody else has to, live your life the way that you choose to. And so it was like, I was so surprised, and I really honestly with it. it was so shocking that he said this, because I was expecting none of it. I was expecting to hear the same thing. Like, it really kind of made me emotional, but it's like, wow, is somebody really out there that's willing to help me and to, you know, not just tell me no, not give me a reason, and being frank with about it, treat me like I'm a child, like I can't make this decision for myself. So, you know, I would reach out to others who have sickle cell, and like I said, get a second opinion, and talk to your partner about it. Like, you know, I feel like a lot of times, especially for myself, like I kept it to myself how I felt, and you know how it made me feel, and things like that. But talking to them, they can help you through the process, you know, so that you don't feel alone and things like that.
That's excellent. And I totally agree with what you said. I think it's important to find a team. So get your hematologist and then advocate that high risk OB, that hematologist and neonatologist, get a team of people that you trust. So I totally agree. And so now I'm going to bring in Dr. Raquel and Chanel to see if they have any questions for you guys. But thank you so much. I know that these are not the easiest topics to, you know, dwell on. So I really appreciate you for letting us tap into your vulnerabilities. And I know that people are going to be really inspired by your stories. So that's all I have. And I'll see if my other moderators have any questions.
No, I'm literally just like so inspired hearing your story, because working like at a tech company where a lot of decisions are influenced by what employees need, it is always so eye-opening for me to see how many Black women don't get heard in these spaces. And so listening to your stories like set me on fire, because one thing that I always advocate for, especially like being on our team, is not just looking at like these common causes of infertility. So it could be like structural or PCOS. Like, yes, those are also equally important, but there are chronic health conditions that get no attention. Like listening to you all explain your stories, I didn't learn any of this in school. I never, you know, knew like how it could affect your pregnancy, or how the drugs or bone marrow transplants, how all of these things could affect you down the line. And so hearing this, it just helps to like really get my wheels turning to say, wow, we're thinking about these very like surface everyday disorders, but what about Black women that have chronic health conditions that really, like you both are saying, are not getting the right information? And so no, I'm just super inspired. I guess the one question that I do have is, when your provider told you like, oh, well, you know, you shouldn't try to get pregnant. Like you said, like you just should be happy to be alive. What do they say are the complications associated with sickle cell? Is it like the vascular piece to it, or what do they tell you is the reason?
Well, see, that's the thing. Like sickle cell impacts anywhere there's blood flow. So that's one of the things, is that you do have to come off of your disease modifying therapies, which we're on to manage our disease. So for me, the concern is that my sickle cell would just run rampant and wouldn't be controlled. And then I also, being off of the hydroxyurea, would have to get transfusions. And I have a lot of antibodies, so I can't be transfused. But then, I mean, there's things that come up about clots and bleeding, and just the additional weight and stress that pregnancy puts on any woman, the concern of what that would do to sickle cell. And there are a lot of complications, but potential complications. But I still feel like if you have the right team, the right support system, faith, the mindset, like Brandy and Ashley were talking about, it's possible. And like I said, we also, as an organization, we get a lot of questions about like doulas and midwives, particularly with the Black maternal health crisis. Like Black women are not really trusting the healthcare system to deliver their babies. And I totally understand why. And so it really does come down to finding that team that believes in you and is willing to advocate and keep a close eye on you.
Yeah. No, I'm literally like over here. So just like so full of emotion listening to your story. I guess like for me, I don't know if Chanel has a question, but I guess for me, for Brandy, what is the one thing that you wish more people knew? Or what is the one thing that you wish like there was more information about, like, before trying to start this family forming journey?
Just in general, I wish that we were given the same opportunities as any other woman, so that like I can have access to information, so that I could have had my partner tested to make sure that they didn't have sickle cell trait. Thankfully she doesn't have sickle cell, she has trait, but I didn't know that. And so here I am pregnant and worried about the potential fact that I might be having a child who has the same illness as me. And so I just wish that we had the same opportunities, like to be able to go and discuss things with them and be able to make those decisions for ourselves. And they don't let us, like I said, they treat us like children. And it's like, no, we told you no, that's what it's going to be. And so, if they didn't just shut us down, then I feel like we would be able to ask questions. But so I really, honestly, everything, because we don't get an answer to anything. It's just no.
Yeah. Oh, I love that. No, that's so true. What about you, Ashley? What do you wish more people knew or you had access to?
Just supportive doctors.
Yeah.
Supportive doctors, because honestly, I'll add this because I feel like it should be known. I had a so with my pregnancy this time, my OBGYN, they were well aware of my sickle cell, everything. They chose to treat me. And then at the end, because they didn't feel comfortable and they didn't want to take the risk, they decided to not deliver me at 30 weeks. So they was like that they would not deliver me there at their hospital. They will not take care of me. I can no longer come in for appointments or anything. They did not want to be responsible.
You know what, to add on to that, when I found out I was pregnant with her at 5 weeks, I was so sick that I went to a hospital I normally don't go to. And when they found out that I had sickle cell, they were like, oh, you're high risk. You have to go to Freighter. Like, they wouldn't even consider seeing me. It was like, oh no, we don't want that responsibility. No.
Yeah.
No, absolutely not.
That's so disgusting.
Yep.
30 weeks, like.
And so now I'm stuck with no doctor, literally. Wow. And so my only option is, I've called around so many places. They don't take people after 30 weeks regardless.
Yeah.
So I basically have to go to a high-risk hospital, and that is my only option.
That's horrible. And it's almost like because they are afraid, they don't want to do the work.
Right.
To educate. Yeah. Yeah. Oh, this is so eye-opening for me. These are things that I honestly never knew. And I love how, like Tiana put it, is that if you have the right team, like if doctors understood, it's not that you can't manage my case. You just have to be in communication with my hematologist or whoever, like, works with me on an ongoing basis, but to just totally like discard me or say like, oh, I'm too afraid. That's insane.
Right. And I think that it also should take a more proactive approach. Like, don't tell me it's not an option or I shouldn't get pregnant. It's the fact that I'm already here. I do want to get pregnant. So you need to equip yourself with the education and the resources to just be able to support me.
Yeah. 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 And doctors do not like learning new things. I'm still young and it's a lot of things I don't know. For sure. But one thing I do know, because all of my bosses are like super old, is that they hate learning new stuff. Can't stand it. Yeah. So it just really goes to show like organizations like yours, how important they really are, because this is how it starts. Like hearing your stories mean more than any research paper, any doctor, hearing your stories that's the proof. Like that's the proof that there has to be more attention to patients with sickle cell, to people with sickle cell, to help, create more opportunities, because this is like unacceptable.
It is unacceptable. And like we have a master class that we're about to put out about women with sickle cell and pregnancy. And that was some of the feedback that we got from the community. They were like, wow, like it's one thing to equip us with all the education, but that's not enough. So we're also offering courses to providers as well.
Yeah.
Yes.
That's important.
Go ahead, Ashley.
No, that was just saying that's important.
Yeah. Yeah.
Yeah, I was gonna say, I don't think anyone has this answer, but I think it's just unfortunate. You almost feel helpless, right? Because we already know that the rates are already high for Black women with just having birth, regardless with
Yeah.
delivering. And then you have a chronic condition on top of that. And so you're now getting providers that don't want to take you as a patient, and you just don't feel, I mean, you don't feel like you have any help. You just feel alone. You don't know what to do. You do know that you want to become a mother. And so then it's just sad. I know it was an article the other day that for Black women, you're better off having an abortion than carrying your pregnancy throughout. And it's like, those rates shouldn't be a thing, right? That should not be a factor, but it's just like, what do we do? It's like Dr. Raquel said, organizations like Sickle Cell Red, organizations like BWW is necessary, but then you actually really need to do those trainings with providers, right? We can talk to our community members, we can talk to women in the community and share our stories and uplift each other, but we still need providers to get that understanding. We still need providers to learn, because, you know, we're still coming to them at the end of the day. I can't deliver my own baby. You know, there's things that we still need help from with providers and physicians, you know, OBGYNs. So I think it's sad, because you want to see a change. You want there to be a and it's just like, when do we get that change? When do we get that difference, right? When the rates for Black women dying with childbirth has been high for years, right? This isn't something new that just out of thin air. Like, we know this has been the case. So it's just like, when does the research get done? When does there, you know, when is there a difference that will be made? Because, you know, we can't keep dying. And we, you know, everyone wants to be a mother at some point, some don't, but, you know, women want to be a mother. So why aren't they able to have that dream? Why aren't they able to achieve that without going and worrying what happens when I give birth? And then on top of that, you have a condition where no one even wants to help you with that condition. You're already high risk.
Yeah.
So I think that's just where I'm at. It's unfortunate. It's upsetting. You just get upset like when you hear these stories, because it shouldn't be the case of what everyone is dealing with right now.
Yeah.
I completely agree.
I guess lastly, I know there's no way to give like resources, but like what can be next, right? So for women that do have chronic conditions, and I know we said like finding a community, that's always great, but then what happens if they don't know to go find a different provider? What if they can't find another provider that actually wants to take them on? Like you said, in Ashley's case, is there any option for you at that point, or do you just have to, you know, go what's given with you or given to you at that point? I know, Dr. Raquel, if you have any resources that women can, you know, use, and I know it gets expensive and things like that, but what can we provide to women that may be able to help just a little bit, even though there's just so much more that is needed?
Yeah, the one thing for me, especially like thinking about like Ashley, thinking about Brandy, the biggest thing for me, and I know Tiana already said this, is the importance of having a team. Like, even though, you know, someone has like a high risk condition or whatever the case may be, it's so much power in having someone to advocate for you. I have a friend, she didn't have sickle cell, but she had a ton of chronic health conditions. And so she had a doula. And so I don't know, like, if patients with sickle cell, if they could benefit from just having additional support in the room. So even if you have to go to a high risk hospital or whatever the case may be, having that doula, because I'll never forget my friend, she has high blood pressure, and the doctor on call prescribed her a medication that could have killed her. And she had already taken it. And it was her doula that couldn't be in the room because it was a pandemic. And her doula literally was on the phone with her like wife and saying like, oh, she cannot take that. She has high blood pressure. And it was that split second where they like gave her an IV to like drain her system, you know, to try to dilute it. But she started having hallucinations and everything from the drug. And the thing about that to me is, as a doctor, and I hate to call people stupid, but that's stupid. Because whenever you put a drug in for someone, it should tell you an alert like, you cannot give this drug with this condition. It's always a contraindication. Like, don't give this pain medication to a patient that has high blood pressure. But for Black women, this is what we're saying repeatedly, is we don't get the same attention and care. It's just like, oh, she's in pain, she's giving birth, I'm just going to give her this pain med without thinking about it. But that doula saved her life. And a lot of providers don't like having doulas in the room, but doulas are essential. And so I definitely don't have an answer to like how to fix high risk conditions, but I wholeheartedly believe having a doula or a midwife just in the room or even virtually with you is something that is low cost and is something that to me could really save your life, because they are very educated and they really do stand in the gap when it comes to like high risk health conditions. So that would be my recommendation, is to try to find a doula to get on your team.
I think that's an awesome point, because another thing was when I had my daughter, I had spent all night being really sick. And after a certain point, they don't send you to the sickle cell floor anymore. They send you to the birthing floor, where they don't really know about sickle cell. And so unless your doctors are walking around like you, they don't really know. And so my mom came in, and my mom was what made them jump into action and actually give me the emergency C-section. And, you know, I honestly at different times have wondered like what may have happened if my mom didn't come in and step in. And, you know, even though she's not a doula or anything, she's been there my whole life, and she knows when something is wrong. And she, you know, hurried and advocated on my behalf when I wasn't able to. And I, you know, think that potentially saved me and my daughter's life.
Yeah.
Because they were not paying attention at all. We were on the monitors and everything. They weren't paying attention.
Yeah, they really, it's insane to see, like, even when I did my rotation in Atlanta, to see the amount of patients OB-GYNs have, it's insane. It's a little bit ridiculous to see how many patients they have and how they're expected to see regular patients and patients that are like in the birthing process at the beginning. It's like, it's too much. And so to me, having that person on your team, because I know for a lot of the patients that I used to have, they might not be able to afford like having this like high risk OB and having this, but oftentimes doulas, you know, if they're just around for a little while, they really are a low cost option, and the resources that they provide are just like limitless, you know. And even, you know, let's say, you know, you are blessed to have a great mom, but what if somebody doesn't? They can really have that advocate in the room with them to say like, this patient, you know, this is my patient, she has sickle cell, we need to be paying attention to these things throughout the birthing process. I think that's super beneficial.
Yes, I think that's a great piece of advice, having, you know, a team surrounding you, right? Because one thing, you don't want to go through that alone, obviously. And then, you know, while you are going through that, you want someone, you know, to speak up for you. I've had friends that, you know, were having so much pain that they couldn't advocate for themselves, right? Because they are dealing with the contractions or everything that's coming along with, you know, giving birth. So you do need those people surrounding you. And that's why we, you know, emphasize doulas or midwives and trying to bring that into the Black community, because it's necessary already just because of the high rates that we see with, you know, death with childbirth. So having those people that advocate, support you. And it sucks that has to be the case, right? It sucks that you have to do this, because you would hope your OBGYN or your doctor would be able to be that person to support you and advocate for you. But it is also great that we do have these resources of doulas, of midwives to, you know, help us during that process, so that, you know, we can try and change things the best way that we can.
Yeah.
There's no more questions. I want to say thank you, everyone, for joining. I think this is a great topic that we were able to discuss. And thank you, Brandy and Ashley, for sharing your stories. Thank you, Tiana, as well, for sharing your story and moderating. Of course, Dr. Raquel, for, you know, giving us that doctor insight. And it's crazy to hear that, like, you didn't learn about this, right? Like, it's like, oh, how, you know, and I know everything changes, right? You know, from older doctors to newer doctors, but it shows that, like, the curriculum isn't adding, right? Nothing is being added to the curriculum of like new things that we're discovering. I took public health courses myself and was even told that, like, I was like, I didn't know anything about disparities or things like that, right? You get the bare minimum. So very thankful to have you guys to share your stories, and we're hoping to share this information to where, you know, someone hears this, learns from it, and, you know, takes it on with them. I think that's the biggest thing. Word of mouth is also really great for subjects like this, just being able to share this story, because it's not, you know, discussed enough. And so being able to share this with your friends, share this with your community, share this with people that you work with, just because it needs to be talked about and we have to keep talking about it. And so thank you all for your time. I really appreciate it.
Thank you for having us.
Thank you.
Praying for you, Ashley. I hope you have a healthy birth.
Thank you so much.